Time after time I was pressured to ignore or more dismiss expert and scientific recommendations. I was pressured to let politics and cronyism drive decisions over the opinions of the best scientists we have in government, and ultimately I was removed from my position. That was Dr. Rick Bright on a call with reporters the day after he filed a whistleblower complaint saying he was demoted from his job as a top-level vaccine expert in the U.S. government. Says he was demoted specifically for resisting on scientific grounds the administration's campaign to use an unproven drug as a treatment for coronavirus. Joining us now is Deborah Catt. She's the lawyer who's representing Dr. Bright in this whistleblower complaint. Dr. Miss Kathy, thank you very much for being here. Appreciate you making time. Thank you for having me. So I understand a little bit because I've read a little bit of the medical literature around chloroquine and hydroxychloroquine and the concerns about its widespread use and the weirdness around conservative media and the president hyping it. The thing that I'm less clear on is why your client thinks that cronyism was part of the problem in terms of why that drug was being hyped and why he was being pressured to go along with that. Well, we're mixing up a little of the allegations here with respect to other contracts. There was clear cronyism. Friends of Dr. Catholic insinuated themselves into the contracting system and pushed for drugs that medical experts and scientists did not favor, and somehow those drugs got approved for the contracts that were very, very lucrative with respect to the anti-malarial drugs. What we know from other reporting is that the president fell in love with this idea that these drugs could work even though his scientists told them that there was no scientific evidence. No data to suggest that this was the way to go, and what you see from the allegations of the complaint and from the emails that were attached, somehow people thought this would be a big political win. If they're donated all of these pills that it was getting from factories in India and Pakistan that were not inspected by the FDA, and somehow there would be a big political win to flood New York and New Jersey with drugs that were unproven and in fact could have had a very I haven't exactly people took those drugs, which is what prompted Dr. Wright to come forward and say no repeatedly, and he tried to do that internally and that did not work. The administration was not willing to listen to the scientists. You may be hearing the breaking news at this hour that Supreme Court Justice Ruth Bader Ginsburg has been hospitalized today. The news from the Associated Press began as a one-sentence story. It said in total quote, Supreme Court says Justice Ruth Bader Ginsburg hospitalized with infection. Justice Ginsburg is 87 years old. She has fought off cancer of the pancreas and cancer of the lung as of January of this year. She declared herself to be cancer-free. But tonight she is back in the hospital, and it is apparently because of her gallbladder. The U.S. Supreme Court has now released a statement about it. It says, quote, Justice Ruth Bader Ginsburg underwent non-surgical treatment for acute. Forgive my pronunciation. Cholestasis cystitis, a benign gallbladder condition this afternoon at Johns Hopkins Hospital in Baltimore, Maryland. Following oral arguments on Monday yesterday, Justice Ginsburg underwent outpatient tests at Sibley Memorial Hospital in Washington, D.C. Those tests confirmed she was suffering from a gallstone that had migrated to her cystic duct, blocking it and causing an infection. The justice is resting comfortably and plans to participate in the oral argument teleconference tomorrow morning remotely from the hospital. She expects to stay in the hospital for a day or two. Joining us now is People Williams NBC and MSNBC Justice correspondent for the latest on this breaking news. Pete, thanks very much for making time to join us tonight. I appreciate it. Think about Ruth Bader Ginsburg is 87. She takes part in the court's historic telephone conference call on Monday, the first oral argument in the pandemic. Then she goes to a hospital here in Washington where they diagnose this condition. She takes part today in the telephone conference this morning. Then she goes up to vote. More than she has the treatment for the cholecystitis, and she's going to be up back on the phone tomorrow morning. So she won't miss any oral argument, but you're right, her health has been the subject of intense interest. She had surgery in 2018 for lung cancer. She had treatment last summer for a cancerous tumor on the pancreas. I suspect one reason she wants to be on the phone tomorrow is that it's the subject important to her. Thus the court will hear arguments in the case about whether the Trump administration Ration can go ahead with its plan to give more exceptions to employers who want to cite either religious or moral exemptions of moral reasons for not providing contraceptive coverage to their employees. Yeah, and issue quite near and dear to her Pete. I neither you nor I is a doctor, and so tell me if I'm actually asking you something here. That is beyond our ken, but I am very focused on two words in the statement from the Supreme Court tonight. One, that this was a non-surgical treatment. Anytime somebody who's age 87 is having surgery, that itself obviously becomes something that you worry about just in terms of the strain on the body. Also, that this is described as a benign gallbladder condition, meaning something that doesn't to be associated with any cancer. It's an infection related to a gallstone. This isn't something that's likely to cause continual or chronic health problems. Does that seem like a fair reading of what the court is telling us tonight? I'm not a doctor either, but I live with one who said, explaining to me that the cystic duct, which is what was blocked here, is what connects the gallbladder to the plumbing that in turn goes into the intestine to help with digestion. So in gets a gallstone like this. He's commonly treated with ultrasound to break up. The gallstone surgery wouldn't be the normal thing for treatment of a gallstone, and then usually antibiotics are administered until to take care of the infection, which is what the cholecystitis has. Remarkable. Do you think there'll be any implications, any changes that will have to go into effect to have the justice on this teleconference tomorrow for those arguments from the hospital as opposed to from her office or her home, wherever she would otherwise usually be participating? I can't imagine. I'm sure she'll just tell everybody in the room to shut up so she can listen on the phone. But I mean, this is one of the advantages to do it by phone, because no matter where you are, you can be in a Supreme Court argument. She takes pride in not missing argument. She missed a few early this year. He had what a state justice described as a stomach bug, coping with the flu, as many people were at that time in Washington. She missed a couple of days, but she won't have to miss this one. She can do it right from her hospital room. He Williams, NBC News Justice Correspondent. Thanks for taking time to help us understand. Repeat. I really appreciate it. My pleasure. Alright, we are going to keep an eye on this star. We'll bring you any updates as we get them this hour, but again, bottom line here is that the Supreme Court has announced that Justice Ginsburg, 87 years old and all of about 3 pounds, underwent non-surgical treatment for essentially a gallstone situation today at Johns Hopkins Hospital in Baltimore. She was in oral arguments at the teleconference oral yesterday before undergoing tests that revealed the condition that needed to be treated. She was treated today. She expects to be back in the teleconference for oral arguments tomorrow morning. Remarkable, and just put your heart in your throat to think about it. Quote, if you include New York, it looks like a plateau moving down, says Andrew Norma, an associate professor of public health at UC Irvine, but if you exclude New York, it's a plateau slowly moving up. And then the X in their data visualization department. They do that work to show you what that looks like right on the left. That is the comforting graph shape. We are also used to seeing by now that is specifically the New York metropolitan area. And that is a terrible thing, right? That represents thousands of cases. And as we know, thousands of deaths. That curve isn't coming down nearly stickly enough, but at least it's coming down convincingly. That's New York on the left. On the right, that's what's happening in the overall American epidemic. If you drop out the numbers from the New York metropolitan area, up. Keep going up. The New York metropolitan area got its gigantic epidemic under control at the cost of 25,000 dead New Yorkers, among other things, but they got it under control. The rest of the country is ascending relentlessly. But for some reason, the way our politics and our brains are working right now, we think we're doing great, as if the whole country is New York, right? We think we're doing great. We're past all this time to stop working on it. Turns out it's no big deal. Why are brains and our politics working that way right now? When what we are going through as a country right now is an exploding epidemic that is getting worse. As I said, testing access continues to be terrible everywhere. Detroit has a big epidemic and a big problem, but they are testing everyone in the places where people are most at risk for dying from this thing, which is a big deal because it means they are finding the bullseye in terms of keeping people alive. Like their Duggan said, the key to everything has been testing. Joining us now is Detroit Mayor Mike Duggan. Mr. Mayor, thank you so much for making time to be here tonight. I appreciate your time. Really have any choice on the testing? We got hit so fast. If I the second week of quarter of our police department was out on quarantined, and it was shocking how fast the virus was spreading, but we got obsessed about the testing off the bat. We did it starting in the police department, where we took the officers through, and if they were positive we got the medical care, if they were negative we got the back to work, and we brought the infection rate down so dramatically that we then looked and said, where is our worst problem? And it's in the nursing homes. And we've now tested every single one of the nursing home residents in this city. And this is the problem of quarter of the people with no symptoms or positive. So think about it, if you're a nursing home administrator and people without symptoms are spreading the disease, you have no way of isolating them, and it really is the reason why rapid testing is at the center of what he's got to do to beat this thing. Are you going to keep testing people in an ongoing way, both the residents and the staff? I imagine this is both a big logistical investment, but it's also expensive. Having a snapshot round of tests is incredibly valuable, but obviously the most value would be if you could continually test. Oh, absolutely. We're doing 1,500 tests a day. Every single worker going to work in grocery stores and drug stores and gas stations we're testing. So we took the state fairgrounds that has 140 acres, and we're testing 1,500 people a day, and it's making a huge difference. 3 weeks ago, we had about the highest death rate of the country. Now, it's dropped 80%, and a half of our hospital bed are empty. People of this city, I'm definitely committed to the social distancing. You don't have to explain to Detroiters that if an African American gets COVID-19, you're 2 to 3 times more likely to die than the Caucasian, and the people of this city have embraced the social distancing commitments. And when you can keep the infectious and non-infectious by the rapid test, there are the tools here, but we brought the rate down very fast. As I said, testing access continues to be terrible everywhere. Detroit has a big epidemic and a big problem, but they are testing everyone in the places where people are most at risk for dying from this thing, which is a big deal because it means they are finding the bullseye in terms of keeping people alive. Like their Duggan said, the key to everything has been testing. Joining us now is Detroit Mayor Mike Duggan. Mr. Mayor, thank you so much for making time to be here tonight. I appreciate your time. Well, thanks for having me on, Rachel. We didn't really have any choice on the testing. We got hit so fast. If I the second week of quarter of our police department was out on quarantine, and it was shocking how fast the virus was spreading, but we got obsessed about the testing off the bat. We did it starting in the police department, where we took the officers through, and if they were positive we got the medical care, if they were we got them back to work, and brought the infection rate down so dramatically that we then looked and said, where is our worst problem? And it's in the nursing homes. And we've now tested every single one of the nursing home residents in this city, and this is the problem of quarter of the people with no symptoms or positive. So think about it, if you're a nursing home administrator and people without symptoms are spreading the disease, you have no way of isolating them, and it really is the reason and why rapid testing is at the center of what this country's got to do to beat this thing. Are you going to keep testing people in an ongoing way, both the residents and the staff? I imagine this is both a big logistical investment, but it's also expensive. Having that a snapshot round of tests is incredibly valuable, but obviously the most value would be if you could continually test. Oh, absolutely. We're doing 1,500 tests a day. Every single worker going to work in grocery stores and drug stores and gas stations we're testing. So we took the state fairgrounds that has 140 acres, and we're testing 1,500 people a day, and it's making a huge difference. 3 weeks ago, we had about the highest death rate of the country. Now, it's dropped 80%, and a half of our hospital bed some distance. You don't have to explain to Detroiters that if an African American gets COVID-19, you're 2 to 3 times more likely to die than the Caucasian, and the people of the city have embraced the social distancing commitments. And when you can keep the infectious and non-infectious by the rapid test, there are the tools here, but we brought the rate down very fast. If other leaders are right now listening to you wishing that they had access to rapid testing to be able to test all of their nursing homes and thinking through how they might be able to walk through how they might be able to do the logistics in their own communities given what you've been able to do in Detroit? Do you have any advice in terms of other public officials who may be wanting to do the same kind of thing that you do, specifically thinking about nursing home residents? Well, for 9 years before I got elected mayor, I ran the Detroit Medical Center, the major hospital system here. So a number of my team came with me. So we had a significant event. We're running a big hospital system during the H1N1 issue in 2009, but we don't spend a lot of time on politics. I'm all day on the phone with labs with doctors, and so is much of my team, and where the swabs, where are the medium, where the vials, who's got the lab. Acity. And then I had the big advantage that Dan Gilbert and Quicken Loans is our major employer here, the people who normally sell you mortgages. They took 40 people and switched them over to a poll setter. And the reason we can run through 1,200 people a day is because they call the quick and call center and make appointments. So it comes through. The average person spends 15 or 20 minutes, but it's a lot of boring details. But given that the state takes it, just was something we felt we needed to do, and the reaction we've got no to the nursing home. Now that the nursing home administrators we're moving to senior citizen traditional housing. Now, they know who's infectious and who's not. They're moving very quickly to separate folks, and we're seeing infection rates go down, and most importantly we're seeing the number of deaths drop dramatically. Detroit Mayor Mike Duggan, thanks for helping us understand this. I feel like what you've been doing in Detroit is different enough from what a lot of other cities have done that it really deserves national attention. Thanks for helping us understand, but you've done. Good luck. Thanks for having me out, Richard. So Ed Snowden, a lot of people in this country are probably curious. When was the last time you had substantive discussions about coming home to the United States? And would this still be your preference? Do you still refer to it as home? The United States will always be my home, and I'll be willing to come back on a single condition, and I've been quite clear about this over the years. This is the government guarantee that I have the right, and every whistleblower has the right to tell the jury why they did what they did. We can disagree about whether this was right or wrong. We can disagree about whether this is good or bad. We can disagree about whether this is legal or illegal. That's right. Proper and democracy. But we have to agree that the jury is supposed to be the proper authority to ultimately decide was this right or wrong, and I hate to say it, but under current laws that is explicitly forbidden under the Espionage Act, which, as you know, it's increasingly being used against the sources of journalism instead of foreign spies. The law makes no distinction between someone who tells a secret to a journalist and someone who tells a secret to a UN government, and so there has not been any movement. Unfortunately, on that conversation since the Obama administration, when I told the government that all they need to do is give me the right of what we call a public interest defense. This is a fair trial, an open trial where the jury hears what is happening. They decide was this justified or not. And unfortunately then Attorney General Eric